So tonight we're presenting the ecological systems theory and older adult suicide rates. Next slide. So prevalence rates of older adult suicides. Suicide is the 10th leading cause of death in the United States. Due to this, suicide is considered a public health issue. In 2019, there were more than 48,000 individuals who died by suicide. In that same year, older adults had the second highest rate of suicide. Um, so, some risk factors for older adults men who are 85 years and older are at a very high risk for committing suicide compared to women and those of a younger age. And also, interestingly, the older adult population is rapidly growing. In 2018, there were 54 million older adults, and it's estimated that there will be 95 million older adults in 2060. Due to the continued increase in the aging population, it can be projected there will be larger increases in suicide for this age group. There are numerous risk factors as well as systematic influences that help to contribute to suicide in older adults. We will be looking at the clinical etiology to explain suicide, but also how micro, meso, and macro systems can influence and increase the risks of suicide among older adults by utilizing the systems theory. Next slide.
So I'm going to cover some of the traditional explanations of the etiology of older adult suicide. Based on psychological autopsy, which is a procedure that investigates a person's death by reconstructing what the person thought, felt, and did preceding his or her death, psychiatric illness is present in 71 to 97% of suicides, with affective disorder, which are illnesses that affect the way a person thinks and feels, being the most common, with major depressive disorder being the most common among those. Primary psychotic disorders, including schizophrenia, schizoaffective illness, and delusion disorder, as well as anxiety disorders, tend to be present in lower proportions. White males have the highest suicide rate across all age groups of older adults than any other demographic. Older adult suicide rates are higher than other age groups because older adults tend to be more successful when attempting suicide, and because older adults tend to use more lethal means to end their lives. Most males, older adults, tend to use firearms to commit suicide, and they are more intent on going through with ending their lives, which increases their suicide rate, the success of their suicide rates. There are several other factors that lead to older adult suicide, such as the frustration of no longer being independent due to losing their driver's license voluntarily, or if it has to be revoked, no longer physically being able to drive, inability to get rides from friends or family, and needing a caregiver to accomplish simple daily tasks such as bathing and getting dressed. We'd like to share a short video with you that will go into a little more detail about this.
One thing that people don't recognize is that worldwide, men and women, as they get older, are at greater and greater risk for suicide. I think it's important and helpful to know that there are just a few things that we associate with suicide in older adulthood that really can be fixed. And when we change those things, when we recognize them and then intervene, that trajectory towards suicide and lives can be saved. The things that pop out and that place older adults at risk are first depression, and by that I mean clinical depression, older person with clinical depression typically is going to be sad. They're going to have lost interest in things that commonly interest them. They might be anxious. They might have trouble sleeping. They might have lost their appetite. Feel a lot of somatic symptoms, as we call them, things like pain and stomach upset and that kind of thing. The second D is debility. It's the idea that even though older people ordinarily almost have one or more chronic illnesses, when that illness or illnesses mount up, when they begin to have an impact on the person's functioning, their ability to maintain independence, and in particular has impacts on things that are personally meaningful. The third D, as I think about it, is disconnectedness. We know that's very important for older people to maintain social contacts and social connections. And so if an older person is withdrawing from or is required to withdraw from social interactions because of physical illness and functional impairment, that disability, or because they're depressed and it's hard to interact with other people, that's an additional risk. The fourth D I think of as access to deadly means. Over 3/4 of older men who take their own lives do so with a firearm. And of older people over the age of 65 who die of a firearm injury each year, 92% are suicides. So having a firearm in the home, we know, of an older person who has these other Ds going on in their life is at significantly increased risk. Older adulthood is not a time when it's normal to feel depressed. It's not a time when it's normal to feel as if your life has no meaning. And if those things are coming across, that should send up a red flag and indicate a time for some additional evaluation, because these are things that can be changed.
Okay, this slide will look at the summary of ecological systems theory. This theory was created by Yuri Bronfenbrenner, and it was originally designed to look at child development and the systems that children encounter, but it can also be used to work with older adults and focus on their environments to better understand their development. There are 5 levels within ecological systems theory. The first is the microsystem, and this focuses on the immediate environment surrounding the individual, which includes their home, school, place of employment, and community. The second is the mesosystem, which focuses on the individual's connections between their different environments, such as home and work, or peers and family. The third is the exosystem, which looks at the connections between environments that may or may not include the individual directly, but it still affects them in some way. The fourth is the macrosystem, and it is the largest collection of people or places that connect to the individual and can still have an influence on them. The last system is the chronosystem, and that examines how changes over time can impact or influence the individual. Next slide. So this slide will look at applying systems theory to microsystems that older adults are working with. So it's important to understand suicide risk in older adults and the connections that it has to their microsystems. I'm specifically in addressing the suicide rates in older adults. So while many social work agencies aren't likely to have frequent contact with older people who take their own lives, the likelihood of some social work engagement is high because of the risk factors and characteristics to those who make a suicide attempt. In particular, older adults are more likely to suffer from chronic pain and terminal illness, which increases their chance for depression. Social work should be mindful of how health can affect an individual's well-being. Also, older adults are more likely to lose their independence and sense of self due to developing disabilities. This can be frustrating and a stressful time, which can lead to more negative thoughts and feelings and thoughts among the population. Social workers can help by providing support and resources, as well as discussing with the clients and older adults how they can find joy in other activities. Next slide.
So this is talking about the application of the systems theory to mesosystems that older adults face. So typically with older adults, they typically lack support networks and family. This is often due to them aging, and typically a family may move away, or friends, or they might even pass away, leaving the older adult alone. Also, older adults who are married, they might lose their spouse. So it can be a really difficult time for them whenever they're growing old. So, due to this, many older adults may isolate, and this causes a lack of socialization. And socialization is super important, just for pretty much all individuals, because having connections helps to reduce depression. And so studies have shown that there's a link between socialization and depression. So social workers who work with older adults can help to identify support networks that an individual may have access to, or they can find them resources, local resources for them to have. This way, they're getting connections that they may have lost throughout their life. Next slide. So the next part we're going to be talking about macro systems. Before we talk about ageism, we're going to talk about honor culture and suicide. So interestingly, it has been found that a lot of older adults have been previously taught in their lifetime not to talk about like their depression, their illnesses, and all that. That wasn't really thought of back then as being important as it is today. So a lot of times these older adults would not seek mental health care, and because they believe that it would threaten their reputation and kind of indicate a personal weakness. Um, so due to this, typically due to this, older adults not getting help back then whenever they were younger, they now are older and they still don't have the help that they need. So oftentimes this can lead them to committing suicide. Another issue is ageism. Ageism oppresses older adults. Ageism often causes them not to be able to find employment. It can cause them to feel belittled and weak. And most of the time, ageism also causes older adults just to be kind of ignored. Ageism also can kind of influence bigger factors like financial, like them receiving housing and financial assistance, stuff like that. Another issue is death with dignity. So many older adults have chronic pain and suffer from terminal illnesses. However, they do not have access to physician assisted suicide due to barriers. So this can so typically they don't have access because with physician assisted suicide, it's only allowed in certain states currently. You have to have a decent amount of money, which typically older adults don't. And also, you have to be mentally capable, and you have to go through a whole bunch of assessments. And as we age, our mental capacity declines a little bit. So oftentimes older adults won't qualify for this. And so this can kind of increase the risk of older adults committing suicide by themselves because they don't really have another option to die with dignity. Um, so social workers can kind of talk about grief and death with their client and explore their client's wishes, by going over their will, if they would like to be a DNR. And social workers can also advocate for assisted suicide for older adults. Another macro issue is finances, which I kind of touched on a little bit earlier. Older adults often do not have a lot of finances due to the inability to work. and due to the restrictions on Social Security. Women are typically more affected by this because of gender roles. So back in the day, women would often take care of the children, so they wouldn't work. So they often don't have a lot of Social Security coming in. Um, so with them having a lack of financial support, this can cause an increase in stress and poor health. So social workers can kind of help to find resources, and they can also kind of advocate for more funds and money for older adults so they can have financial stability. Next slide.
This slide will look at ecological social work and the changes that it has gone through over time. So, the early models of social work weren't really social work. The practice mainly focused on individualistic casework, which was really popular during the early and middle 20th century. Eventually, ecological social work or an ecological model of social work became more popular, and it's very systems based focused, which means it looks at multiple parts within a client's environment versus looking at just the client. There have been some new advances within ecological systems theory itself, um, mainly looking at more empirical and mathematical bases for studying human systems. So, in a study, it found that over the past 2 decades, there have been a mix of physical, social, biological, and computer scientists who have worked to create attention on focusing on two systems related disciplines, one being chaos theory and one being complexity theory. This would seek to look at how nonlinear dynamics affect systems and how sometimes systems don't follow a linear type of path, and it would look at how these affect social perspectives. Next slide.
So kind of what we kind of talked about a little bit earlier, applying social work to older adults. So on a micro level, it's really important for social workers to be mindful of health factors and how that can influence an older adult and their behaviors. Older adults, they often suffer from chronic pain, terminal illness, and it also kind of affects their independence, which can lead to depression if they can't do what they used to. So, really, social workers can help in this area by finding them activities. They can also, yeah, they can find them activities, and they can talk to them about their health. They can maybe find some resources or techniques to help them with their chronic pain. I know mindfulness is becoming popular and has been used in nursing homes with like blood pressure readings. There has been several studies on that, how mindfulness can kind of decrease blood pressure in older adults. On a meso level, social workers can kind of help find more connections and networks for their client. They can go out and look for organizations. They can look at senior centers, find maybe they even have like programs where they have students that come in that can visit. I know right now it's kind of hard because of coronavirus, but just finding more ways to connect older adults to different people and to places so they don't isolate. And on a macro standpoint, social workers can advocate. They can advocate for more resources for older adults, such as more funding for programs. They can advocate for, the option for them to die with dignity instead of, having them to potentially kill themselves. Next slide.
So, the critical assessment of the systems theory, some of the strengths are that it shows barriers for older adults, um, such as transportation, healthcare, and finances, and also overall psychological well being. The theory can be applied to this particular public health issue because it allows social workers to see the bigger picture of how various factors and systems can influence suicide in older adults. In particular, it can show barriers that older adults face, such as transportation, healthcare, and financial issues, which can impact their health and overall psychological well being. The worrying about healthcare and financial issues can raise anxiety and cause, again, higher blood pressure, and um, which increases the risk for heart attack and stroke. Social workers who use this theory will be able to see these effects. Thus, they can advocate for change and policies for their clients, whether it be increases in Social Security benefits or Medicare or Medicaid uh, benefits. This theory can also allow social workers to better understand their clients and the hardships that they face and that they come into contact with. For instance, if an older adult is thinking about suicide, the social worker can discuss the problems that the individual is having and figure out ways um, to address these problems, whether it's applying for SNAP benefits or additional uh, prescription coverage to help cover the cost of prescriptions that will help aid in their finances. The social worker can then work with the client on these solutions to try and reduce the client's stress. Some critical assessment of the theory, some of the weaknesses. It can be extremely complex. It does not look at change over time, and there are struggles within particular systems. Um, it can be difficult to navigate the various systems that older adults come into contact with. Some of their resources and social service programs may be in conflict with one another. An example of this would be if a new senior center opened up and there was no bus route to take an older adult to the senior center where they could socialize and interact with their peers. This can lead to feelings of isolation uh, and this lack of socialization can lead to depression and loneliness, which will increase the risk of suicide, which could potentially increase the risk of suicide. The systems also only look at the present moment, they don't look across time, which can give a more accurate depiction as to why an older adult may be feeling suicidal. Um, Another example, if an older woman may not have worked due to gender roles way back in 20, 30, 40 years ago. Women only had certain jobs or their job choices were limited. Uh, Due to this, she may have limited Social Security, as Erica had said earlier, and they might need extra financial support. And these issues and these financial stresses are causing depression in this older adult. The financial aspect would be looked at, but not how the older adult arrived at that financial crisis. And that's one of the things that this theory misses, is that there needs to be an um, an examination into why people get to certain points in their lives and what can be done to avoid that in the future.